Hello, this is Dr. David Green, CEO of the Washington Pain Network. Today's topic is the basics of sciatica. Sciatica occurs when one of the nerve roots of the sciatic nerve become pinched. And the sciatic nerve itself is here, but it actually is made up of three nerve roots, L4, L5, and S1. As they come out of the spine, they come together and then form the sciatic nerve. 1 to 2% of the population is suffering from sciatica at any one point, with the most common reasons being from either a herniated disc or from spinal stenosis. Less common reasons may be nerve root irritation from degenerative disc disease, a tumor, or possibly a problem that affects the nerve roots themselves. When a disc degenerates, you can get a tear in the outer layer, and some of that inner jelly can squeeze out and pinch on a nerve root. In and of itself, that is not painful, okay? But it's the inflammation that sparks up that can cause pain called sciatica to go down the nerve root, all right? The symptoms may vary of sciatica. It may include burning. The patient can feel an electrical type sensation, pins and needles, maybe some frank numbness. Can also have motor weakness, like maybe inability to lift up the foot. And then rarely the patient can have incontinence. Well, how is it diagnosed? History and physical exam are very pertinent. It can tell the whole story, really. MRI can be really helpful. Here you see a large disc herniation. This is actually the spinal cord and the nerve root trying to get out, but it's being pinched big time. All right. Nerve conduction study can help, and then a diagnostic injection can help as well. Here you see a practitioner doing a straight leg raise test. That pulls tension on the nerve root and will exacerbate the pain if a herniated disc is present. And then typically when you bend the knee, it takes the pain away because the nerve root's not under tension anymore. Treatment for sciatica, there's quite a few here, right? Limited bed rest. Studies have shown that the traditional week of bed rest is not a good idea. Get them up and going as soon as possible. Medications such as over-the-counter anti-inflammatories or prescription ones, muscle relaxers, neuropathic medications such as Neurontin or Lyrica can help, and opiates can be very beneficial as well. Physical therapy and chiropractic treatment may help relieve some of the pain. A TENS unit, such as you see here, they're about the size of an iPod. They have little wires coming out with foam pads to give electrical impulses through the skin. That can change the way that the brain perceives pain signals. Acupuncture can help. Spinal decompression therapy has come on strong over the last decade. And then interventional treatments such as trigger point injections and epidurals. Thankfully, over 95% of sciatica patients are successfully treated without surgery. There was a landmark study back in 2006 that showed the one-year outcome between those operated on and treated non-operatively had the same outcomes at 1 year. So that was very telling. If you can tolerate the pain management and not have to have surgery, then you can pretty much be assured that you'll have the same outcome as if you had it at the 1 year point. Cauda-Equina syndrome is an absolute indication for surgery. That's a large disc herniation pushing and causing bowel and bladder incontinence. That's an emergency. A relative indication would be if you have muscle weakness that's either not getting better or getting worse, such as inability to lift up your foot. And it becomes elective when it's simply a matter of numbness and pain. If you've had 6 weeks of failed non-operative treatment, you might want to start thinking about surgery, but you don't have to have it if it's just pain and numbness. It's an elective quality of life indication. The top non-operative pain management in Washington is through the Washington Pain Network. There are multiple clinics throughout the state. Over 50 insurances are accepted with over 25 treatment options being provided. Overall, the success rates are over 90% at helping patients avoid surgery and obtain relief. Pain doctors are board certified and award winning. Visit us online today at WashingtonPainNetwork.com and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Green with the Washington Pain Network. Your pain stops here.